Adaptation is a real thing. You're treating a disease process for which there is not a cure. I'm very real with my patients as they're sitting in there with me. Like, you're correct. This is not an easy button. And they're like, oh, I know. This is not a magic pill. Oh, I know. But you're treating a disease, right? So your body thinks that this higher weight's where it needs to be. And it adjusts those hormones, it adjusts that metabolism, and it tries to figure out a way around those changes that happen when intrinsically, right? When you have that bariatric surgery. And so for some people, that's going to happen faster. It's going to happen slower. It's going to happen different. Everyone's a little bit different. If all you're doing is medication and then suddenly you're not taking those anymore, all that time you're taking the medication, if you have the disease of obesity, your body's trying to figure out a way around it, right? So then you're starting from a different starting point, even then when you go to bariatric surgery. And then if you've had the bariatric surgery and you've done great, and we're all required to make good choices. Every single one of us is going to have the, consequence to the choices that we make. But that's me, that's you, that's everybody. If you know you're doing the right thing, you've been trained, you know how to use this tool, and then that weight starts coming back or those comorbidities start coming back, that voice in your head and the general public that are all big jerks are saying, well, that failed. Told you so. And because that's what everybody else is saying too, it's easy to believe. And then it's difficult a lot of times. I'm very glad and proud that you stepped up and you said, I need something else. Because a lot of patients, because of that shame, blame, fear, sense of failure, don't, right? They let it come back and they say, it's my fault. Something else that didn't happen. And, I tell my patients all the time, if you're on blood pressure medication and it's working and then it stops working, you don't say, oh, well, I guess blood pressure medicine's not for me. No, you go back to your doctor and you're like, hey, this isn't working anymore. I need a different plan. And obesity is no different. It's a chronic disease. If you're not getting the results you want anymore and you weren't, and you're doing the right thing, then the public is wrong, which we knew to start with. It's not your fault. Come back to your team that wants to work with you, that wants to understand you, and let's figure out a plan that's going to work for you, right? That we can treat your disease in a way that your body and your metabolism and your metabolic kind of system understands, and we can treat it right. But we can't do that if you're sitting at home. And the general public is saying, well, it's your fault. You should stay at home. Even more people aren't coming, which just emphasizes that need. We've got to get that education out. Have to understand this is a disease process. There's no shame in that. If someone else develops a disease, they're going to ask for treatment.